Good morning. I put my contact details in case anybody at the end wants to know anything more. I expect it will be available. And I'm just going to start by pointing out there are many attempts throughout Europe at gathering data on what is being done to these new problems about multiple morbidity. And let's just fill in some of the background. Life expectancy is continuing to rise everywhere, and the main gains in life expectancy now are amongst older people. In other words, older people are themselves living longer. It used to be younger people. Now it's the older people who are also living longer. And it appears we're not, what everybody used to think, programmed to die. We can live much more, and there's no evidence that it's stopped growing, this life expectancy. People constantly say we won't do it, but you've got to think about this, that it is probable that we are going to go on living for a longer time. Secondly, multimorbidity is common, is the norm amongst older people. I just heard a study in from Newcastle in the UK, a study of 85-year-olds. They were all exactly 85. And 3/4 had 4 or more chronic conditions. But, and it's a big but, 78% rated their health as good. In other words, they had learnt to live with these chronic conditions and they were being managed in some way. Notice that 1/4 of the men and 1/6 of the women had no functional limitations. They were all exactly 85. So it's a common, and it's all social classes, it's the whole population of Newcastle. So it's a nice study for you to understand exactly at any moment of time at 85 what people were living with. And a good piece of news is that the rate of dementia, not the numbers, but the rate of dementia is declining. And they point out it was declining from 8.3 to 6.5%. Now, 2 years ago, I was very lucky to be asked to do this piece of research. Why lucky? Because I met a lot of very interesting people doing lots of good things in Greece. And we were very much one of the sort of outliers doing this work. But the iCARE research was about multimorbidity, chronic conditions, which affect, as you can see, 50 million people in the EU, and the estimate is 65% are 65 and more, and by the time you get to be 85%, it's 85% with chronic conditions. And we talk about complex health problems that need continuous and multidisciplinary care. Naturally speaking, this is a challenge to health systems and to social services because they need the cooperation of the two, and we have a real problem because it needs the active cooperation of patients in their own care to make sure that their care is the best they can have for their own good. Yet what we get is a health system, and I do underline this, but under social care system too, which we get fragmented advice, it's incomplete, inefficient, and ineffective. Strong words. And we get conflicting medical advice because we have a highly specialist medical system where each person looks at it from their narrow point of view, from their specialism. We have, and Alexandra just talked about it, lots of preventable hospitalizations. Hospitals are expensive ways of treating people. Prevention and better treatment at home is obviously the way to go. It doesn't need a genius to see that. You can, and I will give the reference at the end, you can find comprehensive integrated care programs as examples in detailed studies in Italy, Finland, Netherlands and Germany. When we talk about integrated care, and it's very much a buzzword, we're talking about something different, not medical-centred, but patient-centred. And it is about, we talk about coordinated, multidisciplinary care, and the role of new technologies in this is essential. how to improve the patient's role in their own self-management, to improve care, doing the caregivers. And please note the caregivers include family carers, they include all kinds of health and social care professionals. When we talk about care, doctors are just part of this care. The majority, when you think about it, of care for the sick is often done by informal family carers. So it's very important to get them online when you talk about integrated care. And so what iCARE4EU describes was innovative approaches to multidisciplinary care. It's got all the kinds of legal problems that Alexander was talking about, but it's nonetheless one of the steps that EU is taking, and I'll land up with another example at the end, to try and bring to people's consciousness what is actually happening and what needs to happen to change our health and care systems. So we were one of the 31 countries looking for good practices, survey data, using 4 perspectives. Patient-centered. How patient-centered were they? How much did they use eHealth technology? That's why I'm here. Financing and management, and professional integration issues. Again, that great difficulty that exists of people cooperating as equals in the process of caring for a patient. There was 101 interesting initiatives. 9 of them were deemed to be interesting from Greece, which is quite a high proportion. And of those 101, 85 used some forms of eHealth. 50 of the initiatives addressed the needs of older people, of which 42 included some kind of eHealth solution, enhancing digital communication, that was 64%, monitoring care processes, 58%, providing decision support systems, and supporting patient self-management. That was the lower proportion. We know in some cases, about 45%, there was actually data on what kind of savings it represented to the healthcare systems. And there was savings. In other words, it was not an expenditure, a higher cost. If you put it into place, it was going to save you money. And the most common bodies actually implementing these integrated care solutions were primary health care practices and general hospitals. And briefly, I'm just going to talk about the 14 centres that I identified. We were terribly lucky. If you remember 2 years ago, Greece had the conference on eHealth, and the ministry was really kind. They didn't know they were doing that for me, but they brought lots of people together who were working on eHealth and made my life extremely easy in trying to identify the many people all over Greece who were trying to do something about eHealth and using it. The organisers chose 9 of these cases as being interesting. And why I just wanted to talk about them very briefly is that they are drawn from the private sector, the public sector, and the NGO sector. So in those 3 kind of quite different economic structures, there were examples of people and systems, organisations that found it worthwhile. The Galilee Palliative Care Unit. We don't have many in Greece, so you may have come across it. Interesting that they were using this to make sure to reach out to people and to coordinate the work of their professionals. The Mestheneos Hospital, very big private hospital. They had somebody in charge of integrated care. They did not just let people turn in and get treated for a disease, and particularly when they're older. They made sure that they did not have other complications, so that they treated them as a holistic person. This is private for profit. They actually thought it worth their while treating the patient as a whole. There was, and I'm sure Dr. Leonis is here, a program funded under EU-wise, self-care for long-term conditions. This is in a primary healthcare unit in Crete. The Actius and the Art Palace, similar, they're joined in fact. They use eHealth for their coordination of the healthcare and social care they give their inpatients in residential homes and other people who come in and use it. Sotiria, I saw Dr. Tizianos pop his head round. He must have been going probably one of the longest, about 15 years, in cardiovascular disease management. And you say there is lots of evidence about savings, and it has stayed in that hospital and it has not been extended. And this is amazing, that the evidence is there and still it does not get expanded. Regions in Thessaly, the regions of Europe, and I can see Dr. Dafrolius, who gets me here, working together for health. And Thessaly is doing some great, I've got two speakers really, people from here, Thessaly, doing great stuff in the field of using new technologies to coordinate care for their residents. The Division of Geriatric Psychiatry, which was a telepsychiatric geriatric service, the Ignitio, which was going to remote villages on the islands in mountains and trying to support people who had no other support. So this is really patient-centered care, using the centre as the basis to reach out to people who have no hope of getting adequate treatment where they live. And the last one was integrated healthcare for HIV patients, not older people in this case. This was HIV, well, they may be getting older now, but certainly in the Red Cross Hospital, and it was trying to get the pharmacy department to work with the other departments in the hospital so that those people who had HIV got the best kind of care they could. What are the findings overall? And this is not the Greek findings, this is the iCARE4EU findings. There's no clear evidence, and I think, Alexander, you in a sense are saying the same thing. The problem is the research is often badly conceived, badly coordinated. We don't have enough really hard evidence sometimes, and the evaluation of programs is often inadequate for policymakers to make decisions about investments. They make decisions, what are we actually going to buy? What are we going to put in place? And it's really difficult. And I think, to be honest, it's difficult because the technologies are also changing constantly. And so what you make about a decision now is based on evidence of 2 years ago or more. And yet the things are running with a much quicker speed than that. And we have problems about when politicians, policymakers make decisions. That policy-making decision is really difficult to decide on when you have inadequate or no funding, very limited funding. When do you make a decision about what you're going to invest in? Even, there isn't something buzzing at you saying, that's it. There's too many technologies being tried out and we have problems. System failures, we have people in very difficult conditions, and more so now in Greece, for example, with our economic crisis. We also have a problem of identifying multimorbidity. People present themselves with a problem. We do not, on the whole, have doctors in this country, certainly, who are trained in geriatrics. It's a terrible problem. And when I say trained, I don't mean that necessarily that they are geriatricians, but that they have an adequate knowledge of geriatrics to understand the problems that people face besides the presenting disease, and that they should be aware of that and thinking about how to deal with this person as a whole. That's not easy when somebody comes and presents with one disease. We have training and disease-specific centered systems. They don't always help. This cooperation between health professionals is essential if you want to deal with multimorbidity. And again, we get the next problem. Who is responsible for this? Is it a bottom-up approach? We have an organisation for family care in Europe, and we have family carers, but they don't have very much muscle. Is it local government? Is it regional government? Is it national government? Where are decisions to be made about integrated care? And it is difficult, this bottoms-up and top-down approach. We've already mentioned the legal and structural barriers and the lack of incentives to change. If doctors get their fee from specialism, then it's quite difficult to change to a system which talks about and deals with integrated care. And I'd hardly need to say anything about how difficult it is under our current financial situation to implement health system reforms. Surviving is the name of the game just at the moment, and multimorbidity often takes a back seat. Many of us don't have a national plan for healthy and active ageing, and health promotion is low. If you want to actually stop some of these diseases, you've got to start in the womb. And I mean that. Paediatricians need to know about aging as much as anybody else. We have a problem amongst the older population of low digital literacy. The smartphone is beginning to break that down. We are beginning to get a system much more used by a lot of older people. It's still education and financially related, but it's very important when you talk about chronic conditions. Access difficulties, the same ones we always expect, rural, urban, social class, education, they are very different in terms of the access people have to health and social care. Mechanisms for maintaining and supporting older users are really something that everybody has to consider when you put in IT systems. And I constantly say that to people inventing and talking about technology. It's not enough to have the technology, you need people to support it, especially for older users. We have a missing geriatric education. Specialist doctors, yes, we need them, but they also need geriatric education because that is where people get sick at older ages. And teamwork is difficult. It's not part of the culture in most countries to actually work as equals and around the same table to find solutions for patients and their carers. And I end with some references because that's always quite useful. And one further research that's being done, this is, you can write them if you want them or you'll get them in your book. Because these projects keep occurring, there's a new one. One of the partners from the previous one is in this, Sustain. And they are exactly looking at how do you make integrated systems sustainable. And they're going to be looking, and I just flag it for you because I think you need to keep an eye on what other countries are doing in this field. And they are developing a toolbox, a roadmap for actually how you go about integrating how you go about getting an integrated system in place. Thank you very much.